Welcome back to the Damien Jones Podcast. Thank you for joining me once again. Take this moment right now to like this broadcast, share this broadcast, share this great information with you because we are about to unpack something you've seen all over your social media platforms the last couple of days is the impact of COVID-19 on the African American community. In Milwaukee, we've seen the death toll being about 50 to 60% of the COVID-19 deaths. In Chicago, it's somewhere around 70%. Even in Louisiana, it's about 70% of deaths. The question is, why are Black folks dying at such an alarming rate? Number one. And number two, are there underlying issues that lead to such? Joining me to unpack these important issues is Dr. Howard Henderson from Texas Southern University's Center for Justice Research, and also family medicine expert, Dr. Chelsea Moreland. Dr. Henderson, Dr. Moreland, thank you for joining me on the Damien Jones Podcast.
Thank you for having me.
Absolutely.
Thank you.
Absolutely. So I'll go to you, Dr. Henderson, on my first question here. Like we mentioned, in Chicago, over 70% of those African Americans who have died from COVID-19. In Louisiana, 70%. But there are civil rights groups who say we need the data. There are other states with a high concentration of African Americans, but we don't know the actual breakdown of the deaths, and it's important. So Dr. Henderson, kind of talk to us, why is it important that we release this racial data as it relates to COVID-19 deaths?
Well, there are a couple of reasons that you need to understand what the demographic composition is of individuals who are tested, who are positive, those that are dying, but also those that are at risk of being infected, because that's necessary to properly allocate resources. And you can't allocate resources equitably without understanding the population from which these individuals are infected, those who are dying. I just got recent numbers that now show that, even though Blacks represent 32% of Louisiana, they are 70% of the COVID-related deaths. In the state of Illinois, Blacks represent 15% of the state, but yet they're 42% of the COVID-related deaths. In Michigan, 14% Black representation, but 41% of the death. North Carolina, we're seeing an even split, 22% of population in death. But in Chicago, we're showing 30% of Chicago's population, but 69% of COVID-related deaths. And so those are just a few of the cities around the country. Wait until we are able to see what the true picture looks like. And in order for us to be able to allocate resources equitably, we must understand the data points.
Right. Absolutely. Dr. Moreland, I want to come to you on this from the practical kind of medicine side. Numbers say that the Center for Disease Control says that high blood pressure is most common in Black folks, about 54%. And Black folks have the highest death rate from heart disease. When you look at all these different maladies, heart disease, diabetes, asthma, and so forth, from your view, does pre-existing conditions kind of play a role, have a strong factor in this alarming rate of COVID-19 deaths among African Americans?
Oh, absolutely. I think when we look at health equity across the board, we will see that there are deficits in pretty much every illness that you can think of. And so COVID-19 is not alone in being that it's attacking the minority and African American communities to a greater degree. When we think about other comorbidities and why it's impacting our ability to bounce back from COVID-19, you have to consider your body's defense mechanisms. And so when we stress our bodies, whether that's from something as simple as exercise, or whether that's something like getting a viral infection or a bacterial infection, your body is created to be able to fight that thing off. But when we compound that our immune system's ability to fight that with the fact that we have diabetes or we have heart disease from uncontrolled or untreated blood pressure problems, or if you have asthma or you're a smoker, those things allow your body to have to work harder to overcome the same amount of stress that the virus may cause on someone who doesn't have those comorbidities. And so that's really what it comes down to when we look at, just from a medical standpoint, why people might not fare as well, because we do have a lot more comorbidities in our communities. And not only are they more prevalent, but you also got to consider, are they well controlled as they would be in another population? And the background of that is actually quite multifactorial. But definitely when you look at, just access to care, that's a huge barrier. Like you mentioned earlier, when we talk about insurance, that's another barrier to care. I work at a community health center, and so we see patients even without ability to pay. But even with that, medications cost money, and those medications are very hard for patients to be able to afford without the financial backing of insurance.
Yeah. And so that's a great point. I'm glad you kind of alluded to that toward the tail end of your comments, just about Black folks, folks of color, brown folks, poor people, okay?
Right.
Don't have the resources. As we talked about, 10 million, and that number is growing. Folks filing for unemployment in the last couple of weeks during this pandemic. My wife and I were just talking about this morning before we came on, just about the stress levels that people are facing from a financial standpoint, the high anxiety and so forth. But this boils down to a wealth inequality issue, particularly if you look deeper than the health standpoint. Let me pull out some numbers here. Southern states, many southern states have refused to expand Medicaid under the Affordable Care Act. And there is a rural hospital crisis in this country. When you talk about southern states, when you talk about rural Midwestern states and so forth, where you find poor people, folks of color, and then in those places, they have higher poverty rates, higher mortality rates, and lower life expectancies than any other regions in the country. And so, Dr. Henderson, as we look deeper into this data, as we talked about, as Dr. Moreland talked about, the uninsured, 4 million African Americans in this country that are underinsured. There are a great number right here in Texas as well. And this is not due because they don't want the insurance. It's because they cannot afford the insurance. You got to rob Peter to pay Paul. Folks are working 2 and 3 jobs to put food on the table. And this pandemic only makes it worse, and we aren't prepared. And so those things lead to pre-existing conditions. When I get a little paper cut, when I get having some issues with my heart or breathing issues, I want to go see a doctor, but I don't have the money to do so. And so we start to use different maladies, remedies from Big Mama and so forth. So Dr. Henderson, it's clear to me, Dr. Moore, it's clear to me that this is a wealth inequality issue. Dr. Henderson, would you agree with that?
Yeah, I think there's a wealth inequality, but a couple points I want to make. Number one, African Americans have a great likelihood of working for employers who don't provide health care. Mm-hmm. But we have to understand that African American community has a notably younger community, and over 40% of all Blacks are under the age of 26. And so when you have that percentage of individuals who are below that age, we understand quite naturally young people still don't see the need in getting insurance. So all of these factors, socioeconomic reality, the employment factor, the education piece, but also just the demographic of being a younger population, all of those add up to force us in a position where we have greater levels of preconditions that put us in harm's way when we're dealing with pandemics.
And if y'all can see those numbers, I don't know if you can see those numbers right over there. 70% right there in Louisiana, in those rural places, in those southern places where folks are, there's great poverty across the board, Dr. Moreland, tell me what you are seeing in your practice as it relates to folks. Again, I know you kind of mentioned this earlier, but as it relates to folks not having insurance with folks of color, and what are some of the challenges that they see?
So, I can say, as it relates to COVID-19, so far we've been pretty blessed in our office-based setting that we haven't seen a lot of patients come in with obvious COVID-19. Many of them have been more of the mild symptoms, but that presents its own barrier to access to testing. And then when you add the fact that you're uninsured to that, even though testing has been in place in Columbus, Ohio, there's still someone has to pay for that testing. And so if you don't have insurance, a lot of our patients are hesitant to come in and either ask for testing or to admit that they've been in contact with someone who had COVID-19. Or they don't want to miss work because they can't afford to miss work. So they don't want to come in for those symptoms, because once I've seen them and I've documented that they had those symptoms, they have to be off work for a certain period of time. Some of the other things I see when it comes to insurance is a lot of the times we are faced with deciding between whether or not we're going to pay for insurance up front to ensure a future or survive today right now.
Absolutely.
And a lot of our patients are just trying to survive right now. And so when I see those numbers, to me, that's what it reflects. It reflects, our patients trying to survive in the moment. Even right now, most of my patients are still working. They may not have, positions in a hospital, but they're still working in grocery stores. They're still working as bus drivers, and they're exposed to a greater extent than many other people in our community who have the privilege of staying home.
Yeah. And let me ask you this, Dr. Moreland, again. What can people do? As we kind of talk about prevention is better than the cure. And I see that different companies are now kind of trying to find a cure. Donald Trump thinks that he has found a cure of some sort. What kind of cure? What can people do to just basic prevention in their homes to protect their families? What are those basic things that you, as a doctor, would suggest to people just to avoid contracting COVID-19 in the best way that they can?
Absolutely. I completely agree. Prevention is the best medicine. The key one is hand hygiene, washing your hands as much as you possibly can, washing them well, which means washing them with soap and water for at least 20 seconds, washing all surfaces of your hands, so both the front and the back of your hand, not just the palms of your hands. One of the other key factors is social distancing, which we've seen repeatedly, videos and memes being posted about people who are ignoring those calls to action or inaction in this situation. But flattening the curve is a very real phenomenon, and if we can stop bumping into one another temporarily, we'll be able to flatten that curve. So those of us who can buy in bulk and stay home and not go to the grocery store every other day, that's what we should be doing. That's going to limit exposure to other people. Family members, you love them, see them in 3 weeks, 4 weeks, whatever it's going to take. Talk to them on FaceTime, talk to them on some other platform, but don't go over their houses. Don't consider it, well, this is my cousin, I know they don't have a contact. Well, we all have contacts. When they talk about degrees of separation, there's only so many degrees of separation between all of us. And so every person I come in contact with, I bring that home to my family every day. And the more people I can reduce in that, the better. So those are the two best things. Is one, try to limit how often you have to leave the house. So if you can stockpile on foods and necessities, definitely do that. If you can, make sure that you have some type of cleaning supplies in your home to clean regularly. Those areas, the kitchen, the restrooms, doors that they touch frequently, packages. Make sure you're cleaning your packages before they're coming in your house, even your mail, wiping them down with whether it's a simple cleaning solution. It doesn't have to be anything special. If you have Lysol, that's fine. If you have like some type of bleach cleaner, that's fine as well. Or just spraying them down, like I said, with Lysol before you bring them in the house. All of that will reduce how many times you contact a surface that someone else left some type of residue or contaminant on. And wash your hands.
Wash your hands. But Dr. Henderson, I'll come back to you here, and Dr. Moore, thank you for those incredible tips to kind of keep us safe. But the data, Dr. Henderson, I want you to kind of unpack this a little bit more. I think it seems like the CDC has been kind of reluctant to kind of release this data. You're hearing some places where folks are saying that states and cities are reporting death, but there's an underreport. I think maybe people are afraid to really tell the general public the truth of the matter as to how this situation is looking. But when the CDC releases this data, I mean, what do you think is there? What do you think we will find just in terms of trends and just reviewing the raw data, Dr. Henderson?
For one, I think what we're seeing is a lack of researchers focused on minority populations, which is the case across the board. Because they have failed to provide the demographic composition of who and what this virus has done to people around the country, we have an inadequate understanding. And because we have an inadequate understanding, we're unable to provide effective evidence-based solutions. So I think what's going to happen is states are going to have to provide that information above and beyond what the CDC may provide, because again, the CDC is trying to tabulate data from all over the country, where local policymakers need to be able to provide access to information for that local community. Even when you look at the CDC data, it's basically on a statewide data. You need to be able to understand the corona issue on a county by county, city by city basis, so that you don't let the averages of across the board understanding across national data kind of misguide or cloud your understanding of what this issue actually looks like.
Yeah. So, and I'll just close by saying this. Listen, at the basic level, Dr. Moreland, Dr. Henderson, to those watching, we have a wealth inequality issue in this country. COVID-19 has not been awesome for any family, for any race, for any section of people. It has been non-discriminatory, but often when we have pandemics or natural disasters, it peels back the onion. And we really get to see the underside of what's really happening in America. And we see poverty, we see race inequality, we see racial discrimination, we see wealth inequality. And when it comes to this issue, 70%, 60%, 50% in urban places, it's simply because Black folks don't have the money to pay for a doctor. We can pass blame and say, oh, folks are still gathering. This stuff kind of happened out of nowhere. We can't blame people for still doing the same behaviors that they've been practicing for a while. And it takes time for people to kind of change those behaviors. And I think folks are doing a pretty fair job of practicing social distancing. But at the basic level, the issue is not social distancing. This issue is we need to make sure that we spread the wealth in this country and make sure the rich pay their fair share, and that we lift up those who are mired in poverty, number one. And our lawmakers need to do a better job of making sure that we have affordable health care for all people. There are different conversations around health care for all, or whether folks pay for it, those different, I don't care what it is, but folks need to be able to see a doctor, to have their maladies reviewed, and also live a good life and a life of pursuing happiness as talked about in the Constitution. Dr. Moreland, Dr. Henderson, thank you so much for joining me on the podcast. Stay safe.
Thank you for having me.
Thank you.